Tuesday, December 17th, 2002. What happened to me that day is something that nobody expects is ever going to happen to them. It was certainly nothing that I ever expected. I never imagined anything like that. That's the day I contracted and almost died from an infectious disease called bacterial meningitis. I never expected it was going to happen to me. Nobody ever thinks it's going to happen to them. That's the last thing that you think is going to happen to you, is to contract some fast-moving, often lethal disease just out of the blue. And yet, that is exactly what happened to me. I woke up on the morning of Tuesday, December 17, 2002, with a major headache. It was the worst headache I'd ever experienced in my life. I continued to stay in the bed for a while, but it didn't get any better. Finally, around 9 or 9:30, a friend of mine happened to call. That call quite possibly saved my life, because I told him what was happening. I told him I was experiencing a very severe headache, and for some reason it just would not get any better. He said that he would call me again and check on me in about a half hour after we talked a little bit about it, and if necessary he would come down and drive me to the hospital. But the pain didn't get any better. It just got progressively worse. It was the worst headache I had ever experienced in my life. Finally, in our second conversation, I told him, I think I'm going to need you to come down here. And he did. He drove 30 miles to come and take me to the hospital. This is a very close friend. His name is William Mark. Now he's a professional truck driver. In a sense, you could say that he was a brother from different parents. I don't like to use family analogies because I don't much like, never mind about that. But Mark drove me to the hospital, and by the time we got there, I was almost delirious with pain. I remember we walked into the wrong entrance of the hospital and were directed to the emergency room entrance. We walked into the emergency room entrance and went to the registration desk to get some help. And the last thing that I remember from that day is telling somebody, looking over some paperwork, I need some help. And that is the last thing I remember from that day. I didn't just faint in the emergency room. It wasn't just a stress headache and I was freaking out from stress or something like that. If only it had been something like that. If only it had been, too much stress and a headache and getting a cold compress and some anxiety medicine and some pain relievers and going home the rest of the day. But it wasn't that. What I was told later was it was a seizure. Something I'd never experienced in my whole life. A seizure. And they had to rush a gurney out there, and I'd be strapped down and taken back to the emergency room and sedated because I was experiencing this very severe seizure. And I was rushed back for a CAT scan right away, and the CAT scan apparently revealed, I don't remember any of this part, but the CAT scan apparently revealed severe brain swelling. Well, it happened that my doctor, the one I'd used as my personal doctor, had an office across the street from the hospital. This was in Bessemer, Alabama. It was a hospital called UAB Medical West. Fortunately, the hospital was only about a mile away from my apartment. Dr. Wiley Livingston, an infectious disease specialist, and he had been my personal doctor. He was called over, and it wasn't long until he decided that it was necessary to order a spinal tap, and the spinal tap revealed bacterial meningitis. So I was admitted to intensive care the first day, and Mark took care of calling relatives and friends and people like that. You know how bad news spreads fast? I think probably everybody I'd known in the previous 20 years knew what happened to me before that day was over. But people began to come to the hospital, or so I am told. I do not remember it at all. My first conscious memory after telling somebody I need some help in the emergency room that first day is a very hazy memory of being in ICU with a breathing tube down my throat, and I was trying to swallow and I could not swallow, and I hated that. It was just the worst feeling, and it was all rather hazy, and I was in this hospital bed, and I felt this weird sensation as if the hospital bed were moving up and down like a seesaw or something, and that couldn't have been happening. That had to have just been my mind. But it seemed like this hazy sort of hellish situation went on for a long time. And then after that, I have a clear memory. First clear memory. Apparently I woke up suddenly, like I always do, from anything like that, from going to sleep at night or from whatever. Woke up really suddenly, and the first person I can remember talking to was a minister from the church that I belonged to that time. I believe it was the Reverend Kenneth Wilson. And that's when I found out that the disease I had contracted was bacterial meningitis. It is an infectious disease that you contract very quickly, and it can move very quickly. And I was told that the last person who had been admitted to that hospital with bacterial meningitis was dead within 12 hours. That's how fast it moves. Well, the day before Christmas was the day that I woke up. I had been in a medically induced coma. And I know that sounds bad, that they would do something like that or have to do something like that, but what it actually is for is to protect your brain. They're trying to protect your brain from injury when they do that, so that's what a medically induced coma is. It's a bad situation to have to be in, but they do it for your protection. They really do. But I was allowed to come out of mine the day before Christmas and was moved from the ICU into a regular hospital room. Well, you know, my friends were all happy that I was doing better. Apparently, I had come really close to the point of death, and then it just sort of magically, or so it appeared, turned around one night. As Dr. Livingstone later told me, one day you were dying, the next day you were well. And I had been treated with 3 antibiotics at one time. And not only that, I'd been intubated and was being, a breathing machine was actually doing my breathing for me for a while because my lungs had shut down. But I was then wide awake and moved into a regular hospital room. And I was clearly on my way to recovery as I was talking normally, and I could feel and hear and see everything and knew where I was and knew what was going on and knew that I had contracted meningitis, and I was now in this hospital room. But a serious complication arose. I had been off my feet for so long, well, not really a very long time. It was just a matter of days, and if you don't think exercise is important, I'm going to tell you it is, because it didn't take but just a few days of lying on my back almost motionless to lose my ability to walk. I went virtually lame, and my muscles were not able to hold up my own weight, and some rehab was required pretty quick, and that caused some significant problems. So then I spent a while in the hospital, several more days actually, and the trouble with that is I'm hooked up to all these IV lines and other lines, and I'm a tosser and a turner, and so that made for some pretty miserable nights in the hospital. But finally, on the 12th day, I was released to go home, and the doctor, Dr. Livingstone, he tells me, he said, you understand how serious this was? I said, yeah, I understand that it was about as serious as it can get. He said, you almost died. He said, as a matter of fact, we're calling you Lazarus. And apparently I'd had a lot of visitors during this time. Mark had stayed with me during the worst periods of time, and I had some friends and relatives and other people who came in. Most of that I didn't even know. But then I was released from the hospital, and I was on my way to recovery, except that I would tire very easily. And after I got to where I could walk, I would still get tired really easily. And within a couple of days from my release, I developed Bell's palsy, meaning that half my face was basically paralyzed. And not only was my face paralyzed, but I kind of lost my hearing in my left ear. Well, that was successfully treated with a great drug called prednisone. I took that for a little while, and the problem went away. I was very fortunate in my experience with bacterial meningitis because I recovered completely. But that is not the case with a lot of people. A lot of people die, and a lot of people suffer long-term impairment. I recently connected with a new Facebook friend up in Bend, Oregon. His name is Jesse, and he is also a meningitis survivor. But for whatever reason, the damage to his central nervous system was far more severe. He was hospitalized for 3 months. he lost his hearing, and he had to have a surgical operation, and now finally some of his hearing has started to come back, but he's still in the recovery process. The damage was much more severe. Now, why am I telling you all this? Because bacterial meningitis, what happened to me, can happen to you. It can happen to just about anybody. And almost nobody knows this, that there's this horrible disease out there that can come up on you and kill within hours. And so I want to tell you a little bit about how to recognize bacterial meningitis, what needs to be done, and how you can prevent it. You know, some scary things about bacterial meningitis is that a large percentage of the people who get it are just babies, small children, and they can't tell anybody what's wrong with them. And then another large percentage are college students living in dormitories. And, you know, they're young people, and they're not expecting anything like that to happen, and they don't know what's happening to them, and people around them don't know what's happening to them. And a lot of times treatment is delayed until it's too late, because you need treatment, and you need it fast if you've got bacterial meningitis. So it's very sad, very unfortunate that a lot of young people actually die from this horrible disease. Because when it comes on you, you don't know what's happening. And the people around you don't know what's happening either. And in my case, I was uninsured, and I hesitated to go to the hospital. I told somebody later, if I knew known what was actually happening to me, I would have called the paramedics. But as I said to somebody at that time, who calls the paramedics for a headache? And that's what it was. It was the most severe headache that I'd ever experienced in my life. I was told later that my temperature got to 109 degrees, as my immune system just sort of went into turbocharged overdrive, fighting off this alien infection. And I was treated with 3 antibiotics and had to be in this medically induced coma to protect my brain from further injury. And it was just a horrible experience in many ways. There are things in life that I would not wish on any other human being, because it's just too terrible. And bacterial meningitis was one of them. That was a horrible experience for me. I cannot describe how bad it was to have this breathing tube down my throat and be struggling to swallow and couldn't swallow, and it seemed to go on for a long time. Nor can I describe how bad the pain from that headache was. What is bacterial meningitis? It is an infectious disease, and the easiest way I know how to explain it is that it involves brain swelling. There is swelling around your brain, and it creates immense physical pressure on your brain. And that physical pressure on your brain, that's what caused me to collapse in the emergency room, and it's also what caused me to have see some strange things and have a lot of strange feelings later, because there was some temporary brain injury, although it did get better. I would not want what happened to me to happen to anybody, and I definitely wouldn't want what's happened to Jesse, my Facebook friend, to happen to anybody. That poor guy, 3 months in the hospital, losing his hearing, finally getting some of it back. His situation was truly terrible, and it's my hope for him that he will experience a full recovery. I know a little bit of what he went through. My situation was much shorter and much less severe than he was, but I do have an idea. And I told him in a recent message, just be patient with yourself, give yourself time, take it easy. Healing can take a long time. Mine, fortunately, didn't take that long. Within a couple of months, I was normal. But it was a near-death experience. It was a horrible experience, and it is something that does happen to quite a few people. I never expected to get bacterial meningitis. I didn't think I was going to be near death from some weird disease like that, but it sure did happen, and it happened to me, a person who doesn't usually have that kind of bad luck. So how do you recognize bacterial meningitis? Well, as I said, the symptom that I remember most was a very severe headache. And it was a headache that did not get better. It just kept getting worse. So if you ever experience that severe headache that just goes on and on and on, and it just keeps getting worse, and it's the worst thing you've ever experienced, you need to get to the hospital, or the person that you are with who is experiencing that needs to get to the hospital. That very severe headache. And it's hard for me to imagine, given that it's brain swelling, that anyone wouldn't experience that. Now, how do you prevent bacterial meningitis? Well, I understand there is a vaccine that can prevent it, but two things I was told was, although we don't know exactly how I got bacterial meningitis, I was told that if I had a flu shot and a pneumonia shot, it never would have happened. So that annual flu shot is very important, not just for people who are at risk. It's important for everybody now. I mean, even if it wasn't for something like meningitis, who wants to get the flu? The flu's a terrible thing to have. It's an awful experience to go through. But a flu shot and a pneumonia shot can actually protect you from bacterial meningitis, and that's something you don't ever want to get. Another thing, cleanliness is very important. Now, I always knew the importance of hand washing, but I never took it as seriously as I did after that experience, because the bacteria that can cause meningitis, believe it or not, is with you all the time, right up here. And you know, the way that we get an awful lot of diseases, respiratory tract infections and so forth, is right here, the mouth and nose. And the best way to protect yourself there is to keep your hands clean. And the best way to do that is to be very diligent about hand washing and make sure that you get them very clean. Now, I'm not a germaphobe or anything like that. You don't have to be a germaphobe, but recognize that clean hands are extremely important. So take that seriously. Get your pneumonia shot. Get your flu shot. And keep your hands clean. And that goes a long, long way toward protecting you from bacterial meningitis. And those are very simple steps that anybody can take, but it might protect you from a disease that could possibly kill you, as it almost did me. And then, so those are some preventive things, but some other things, remember, if you or a person you know ever gets a very severe headache, and that headache won't go away, and it seems to just continue to get worse, get yourself some help. Get to a hospital emergency room. Don't go to an urgent care center. Don't go to a doctor's office. Don't call and make an appointment, because bacterial meningitis is a disease that can come on you and kill quickly. If you experience that severe headache that isn't getting any better, that won't go away, get yourself to a hospital emergency room, or get that other person to a hospital emergency room, because treatment needs to start right away. It's the delay in treatment that causes people to die and to possibly experience very severe damage to themselves. And I do not want anyone to ever experience what I experienced. Now, as I said, my recovery was a very quick turnaround. And there has been speculation and there has been talk about whatever the transcendent purpose might be for being spared or for surviving. Dr. Livingston told me that one day I was dying and the next day I was well. And we have our beliefs about why that happened. I won't get into all that, because I know there are some people on here who won't share in that. So to avoid getting into that kind of discussion, I won't say that. I do think there are transcendent reasons, and I can look back on what's happened since and possibly see some reasons that it could have been. But I was a fortunate one. I was spared. I did achieve a complete recovery from bacterial meningitis. But, you know, if I had a choice, I would choose to never experience that again. And I do not want another human being to ever experience that again. That is something I could never wish on another human being, but I do want you to know about it. It's a fast-moving, deadly disease. It comes on very quick. The most noticeable symptom is a severe headache. If you experience one of those and it doesn't go away, get to a hospital. Ways to prevent: flu shot, pneumonia shot. Be diligent about hand washing. And that's basic information that can possibly save your life. So, now you know.